Hello everybody, welcome back to our pelvic floor video series. Today we're going to be talking about diastasis recti. For those of you that are new, my name is Rachel Richard and I am an orthopedic physical therapist that has postdoctorate specialization in pelvic floor physical therapy. Today we're going to be talking about diastasis recti. So what is diastasis recti? Diastasis recti is basically just a separation or a gap in between our rectus abdominis muscles, otherwise known as our six-pack muscles. So normally our rectus abdominis muscles do not touch each other directly. They actually connect to each other via a connective tissue called the linea alba. So this linea alba is what separates and causes the diastasis. The linea alba thins out and pulls apart when there's an increase in pressure in our abdomen. So usually the diastasis will present as a separation or a gap, also doming or coning or bulging in the abdomen as well. The diastasis can be measured above the belly button, around the belly button, and below the belly button, and it also can be all the way up and down. So who can have a diastasis recti? What populations can be affected by this? So both men and women can have diastasis recti. It is more common to happen in females, especially women who are pregnant or who have had babies, but other people can also have diastasis recti, such as female and male athletes who do a lot of overhead heavy lifting, people who have very high laborious jobs who are doing a lot of lifting from the ground, a lot of carrying and twisting and turning, and also people who have a history of chronic GI or gastrointestinal issues, chronic pelvic or abdominal pain, and also people who have had abdominal and spinal surgeries. So how do we test for diastasis recti? What is it going to look for when you come into the clinic and you've either been diagnosed with diastasis recti or you're just coming for a pelvic floor examination? So the first thing that I do is I'm going to have my patient lay on the table on their back with their knees bent. And the first thing that I look for, I just palpate or feel the front of your abdomen to feel for anything that feels abnormal, any sinking in or anything that is sticking out or bulging. And then I am going to gently place my fingers, my first two fingers on their abdomen. I'm going to start further up on their abdomen above the belly button, and I'm going to have the patient lift their head and their shoulders off of the table, and I'm going to gently sink in with my fingers, feeling for a separation. Now, if my two fingers fit snugly and nicely in the separation, then I'm going to say that you have a 2-finger width separation of diastasis. If another finger or say a half a finger could fit in the space, then I would say you have a 2.5 or a 3-finger width separation. You can also measure above the belly button, closer to the belly button, and then underneath, because the separation can be different widths along the linea alba. Okay, so what can we do to treat diastasis recti? I just want to start off by saying that diastasis recti is something that takes a lot of hard work and dedication to get better and for it to heal. It's not going to happen overnight. There's not some magic quick fix to make it better. The diastasis forms over a while, so it takes a while to get better. Most exercise regimens should be specific and individualized to the person because everybody is different. It depends on what you do for a living, it depends on what you do for exercise. If you do CrossFit, if you jog for exercise, if you do yoga, the specific exercises for your diastasis are going to be different from somebody else's. So that's why physical therapy is so important for this, because we can create that individualized plan for you. So two of the biggest things that we want to focus on with diastasis recti: proper breathing mechanics and core strengthening. So the first thing with proper breathing mechanics, the biggest thing that I talk about with my patients is to make sure that you are breathing properly when you're lifting loads, so that you are exhaling when you're lifting something, you're exhaling when you're twisting, anything on the high exertion that you're breathing out. Another big thing is that you're not bearing down or holding your breath when you're lifting. If you have diastasis and you are a weightlifter, not doing the Valsalva maneuver is really important because that can worsen your diastasis. Also, making sure that you're not bearing down and pushing when you are having a bowel movement is extremely important as well, because that increases that pressure in your abdomen, and that's what we don't want, because there's already too much pressure and not enough strength. So we want to make sure that you're using your muscles as stability for your abdomen and not the pressure in your abdomen. And we also want to make sure that when you're doing exercises in general that you're breathing properly. So when you are doing the more exertional portion of the exercise, that you're breathing out instead of holding your breath or breathing in. Okay, the second part that is extremely important with diastasis rectus, part of treating it, is working on abdominal strengthening, specifically our deep abdominal muscle called the transversus abdominis, or the TA muscle. When we talk about our abdominal muscles, I'm talking about that TA muscle, that deep core muscle. So that's extremely important when we're trying to treat diastasis recti. The first thing that I do with my patients is to just make sure that they can even, one, locate the muscle, and two, turn it on and know how to work it. That muscle can be turned off, or the function of it can be decreased with surgeries, with pregnancy, with pain. So most of the exercises are going to be pretty general. They may seem kind of boring or easy in the beginning, but it's just because we have to make sure that you're doing it correctly, and then they progress to more advanced exercises and more functional exercises such as lifting, twisting, turning, doing transfers, getting in and out of bed, getting in and out of the car, all while properly activating that muscle and making sure that it's coordinating with your pelvic floor muscles and your multifidi muscle, so it becomes really functional. So you can see that she has coning, doming here. Okay, go back down. Okay, so that usually happens when people are not properly activating their TA muscle before doing an abdominal strengthening exercise. So now, let's activate your TA, so belly button enters your spine. Okay, so a little bit gentler, not as strong. Okay, hold that, and now curl up. Good, and back down. Okay, let's do it with no activation at all. Good, and then back down. Okay, now activate your TA, and then curl up. Much better. Good. One last important point to talk about with treatment of diastasis is that for the population that want to be pregnant, or maybe getting pregnant in the future, or if you already have diastasis but it's small, you can definitely come to physical therapy, to pelvic floor physical therapy in particular, to already start strengthening those abdominal muscles and start working on your breathing and your load management, and that can actually help decrease the incidence and the severity of your diastasis as well. Thank you so much for listening today, everybody. I hope that you learned a lot. If you feel that you may have diastasis recti, or that you have been diagnosed with it, please feel free to call this number on the screen, or go to the link on our website to request a free consultation, or to schedule an initial examination with the pelvic floor therapist to learn more about diastasis rectus and what physical therapy can do for you.